Hello everyone. This is Dr. Omar Shakoree. I am a senior house officer in accident and emergency surgery. Today, we will speak about very important topic, which is the snake bite, and another topic is associated with this topic, which is the scorpion sting. Both topics will be discussed according to the guidelines of Australian practice. So if you are practicing in Australia or you are practicing according to the Australian guidelines, this lecture is suitable for your knowledge. Why I am choosing snake bite and scorpion sting as a presentation for today. Those topics are very common to be seen in the practice, in a clinical practice, in the emergency department, but unfortunately, we have an insufficient data about those topics, the snake bite and the scorpion sting. So we will take just a few notes and I will give you a lot of information, but I will focus on the very important questions that any examiner will ask you. If you do an AMC clinical exam, there are specific questions for the snake bite scenario or the scorpion sting scenario. So I want you to focus on this class. Also, this class and other classes like this will be available in our website for free. Our website is, I mentioned it down, somastudy.teachable.com. You can find this class also later on in this site. Also, it will be available in our YouTube channel, inshallah. So are you ready to start, please? Okay, Dr. Amrit is ready, and that's good. So what we have today, we will speak about the background of snakes, classification of snakes, mechanism of toxicity that the snake bite cause, grading, investigation, and management. And here are the most important parts of this lecture. The grading, you have to memorize it. The investigation that you need to send a patient with a snake bite for, and how you will manage patient with the snake bites. So let's speak about the background. Regarding background, I want you to know that there is a lot of species of snakes, about 3,000 snakes. Please just confirm that you can see my pointer. Can you see the pointer or not? The mouse pointer. Okay, so that's good. So there are more than 3,000 species of snake, and only 15% are dangerous to the human. This is very important to know because most of snake bites are non-poisonous species. Most of snake bites are non-poisonous. The family, which is, and we will speak about 3 families, Vibridia. Vibridia is the largest family of venomous snakes, and this can be found in Africa, Europe, Asia, including Australia and Americas. It's very important, the vibrates. Other family, which is Elapidia, is the next largest family of the snakes. This is not so important. What's important in this slide, in this introduction, is to know that there are a lot of types of snakes, and most of them are non-poisonous species. This is very important note. So what are the classification of snakes? We have Elapidia, we have Vibridia, which is the largest one, we have Hydrophidia. The Elapidia cause neurotoxic material. The Vibridia cause vascular system toxicity, vessels problem. The hydrophilia cause toxicity to the muscle. So what I want you just to know some of them, not to save them, not to put them in your memory, just I want you to know some of them. Elapedia, for example, what are the example of Elapedia? The common cobra, the king cobra, the crate. I will jump to the pictures. This is a cobra with double septacular mark, and this is cobra, and this is monocellate cobra. As you see, this is double, and this is monocellate. That's the difference, but both from the same family. They are from the Elapedia. Elapedia cause neurotoxicity. Elapedia will cause neurotoxicity. So the cobra, the king cobra, and also the crate, and this is the crate, the common crate, those will lead to neurotoxicity. Clear until now, please? Okay, Dr. Mariam, I will repeat this. We will classify the snake into three families: the Elapedia, the Vibridia, and the Hydrophidia. The Elapedia will cause neurotoxicity. The Vibridia will cause vascular system toxicity. The Hydrophidia will cause myotoxicity. Until here, is it clear, Dr. Mariam? Okay, now we will speak about types of Elapedia and types of Vibridia and types of Hydrophidia. As example, from the family Elapedia, we have the king cobra, and we have the common cobra, and we have the crate. Where are those? This is the picture. This is a cobra. Everyone knows it. It's the beloved snake in the movies. This is the king cobra, common cobra, which is seen in Burma, India, Sri Lanka most commonly. And this is a cobra, this is a cobra, and this is a crate. This is the crate. All of these are from Elapedia, and they are neurotoxic. This is number one. Number two, what are the Vibridia? Vibridia, we have two groups, the pitless vipers and pit vipers. Those are pictures of Vibridia. I want you just to take a look of the picture, not to memorize this. We are not, until now, I want you just to focus on the things that are important. I will repeat them later on also. So this is the vipers, and this is another vipers, and I told you in this slide, the vipers, the Vibridia family, have vascular system toxicity. They affect the vessels. They affect the hematology of the patient. Third family is the Hydrophidia, which cause myotoxicity. Hydrophidia, as an example, there are 20 types of sea snakes found in India. All are poisoned and they are myotoxic. Sorry, I couldn't find any picture for that. Can you see the screen or not, please? Please, can you see the screen? I said previously that we have three types until now. What's important in the snake bite? I will review it. What's important in the background is to know about there is a lot of species, but most of them are non-poisonous. And regarding the classification, we have three classes, three families. The Elapedia, which is, let's say, the cobra, the king cobra, which is neurotoxic. We have the Vibridia, the vipers. The vipers, those are the snakes that most of them you can find them in the water. The vipers, most of them near the water, near the lake, most of them are available there. Those are the vipers snakes. So those are hemotoxic. vascular system toxicity, hemotoxic, hematological problem. And lastly, the hydrophilia also near the water, and they are myotoxic. Is it clear, please, until now? Is it clear for everyone? Okay, just type for Dr. Marvi to open his microphone so he can hear us. Any one of you just type this for Dr. Marvi so he can hear my voice. Now you can hear me, Dr. Okay, now regarding the mechanism of toxicity. Mechanism of toxicity, we have cytotoxic effect on the tissue, hematotoxic, neurotoxic, and systemic effect. And this is not so important, just there's a few notes are important in mechanism. We as a doctor, we need to know some few points about the mechanism, but we need to know everything about how we will manage, how we will make a grading for the snake bites patient. So toxic dose, the potency of the venom, blah, 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 and the amount of the venom injected is vary considerably. You cannot depend on that toxic dose. There's nothing called toxic dose for this patient. Stop video, please. What about the necrosis? If you have a snake bite and you have seen a necrosis patient, snake bite and necrosis. Here, I want you to know just how this will happen in a snake bite. We have, for example, this picture. Patient have a snake bite in his foot, right foot, and then this patient developed necrosis in the lower limb. What could be the mechanism? There's a proteolytic enzymes have a trypsin-like activity, and there's a rule for hyaluronidase and phospholipidase A2, and all these enzymes, as simple as that, all these enzymes, the phospholipidase, the hyaluronidase, the proteolytic enzyme, all those enzymes cause edema, then blister formation, and local tissue necrosis. That is the idea of how snake bite lead to necrosis. As simple as that. If you have this question from any examiner or anyone with you working with you in the hospital telling you how this necrosis happened, tell them as simple as that. There is enzymes that cause edema, blister formation, and this will lead to necrosis. What are those enzymes? Phospholipidase, hyaluronidase, proteolytic enzyme having a trypsin-like activity. Regarding the paralysis, how the snake bites lead to paralysis, also you have to know some notes about that. It will block the stimulus transmission from the nerve cell to muscle. This is the area of action. It will block the stimulus transmission between the nerve cell and the muscle, and this will lead to cause paralysis. It does not penetrate the blood-brain barrier. It will not go to the brain and affect the brain. Postsynaptic blah, 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 it's not important. So just I want you to know that the snake bite or the toxin from the snake, it will lead to paralysis. How this will happen? By blocking the stimulus transmission between the nerve muscle and between the nerve cell to the muscles, and this will lead to paralysis. How the snake bites lead to hemorrhage? By what? By activating the prothrombin, by effect on fibrinogen and convert it into fibrinothrombin-like activity, such as crotalase, and activate factor 5, factor 10, protein C. All these are factors for bleeding, and activate or inhibit platelet aggregation, and also hemorrhaging that cause endothelial damage. So it will activate. We have, I think, another 2 points. Okay, no. We have the snake bite related to the hemorrhage. It will activate prothrombin. It will activate, this is the most important notes. It will activate prothrombin, and also it will activate factor 5, factor 10, protein C. This is the most important, and inhibit platelet aggregation. I will repeat the action again. We have hemo problem, neuro problem, and cytotoxic problem. Regarding cytotoxic problem like necrosis, it's caused by 3 enzymes, which are proteolytic enzymes, which are hyaluronidase and phospholipidase A2. All these enzymes will lead to edema, blister formation, then local tissue necrosis, as simple as that. Paralysis is because of the toxin block the stimulus transmission between the nerve cell and the muscle. For hemorrhage, because there's activation of prothrombin, also effect on fibrinogen and converted into fibrin, thrombin-like activity, and also activate the factor 5, factor 10, and protein C, and inhibit the platelet aggregation. Clear until now, please? Now, there are some syndromes. They find some correlated, let's say, correlated features to make them as a syndrome for the patient of snake bite. But remember, the grading, we will discuss it in a few minutes. The grading is the most important part of clinical presentation of snake bite. The grading, how you will grade this patient. So some syndrome, I don't want you to memorize them, just to have an idea. If you hear that this is syndrome 1, snake bite. So what's syndrome 1? Syndrome 1, when there's local swelling, envenoming means swelling, to make it simple, with bleeding, clotting disturbances. Local swelling with, let's say, ecchymosis, bleeding, clotting disturbances. This is caused by vibrio. This is mostly caused by vibrio, and this is called syndrome 1. Syndrome 2, if you have patient with history of snake bites and he presented or she presented with ptosis, external ophthalmologica, ophthalmoplegia, and facial paralysis, as you see, there's something abnormality in the face. Snake bite, problem in the face, dark brown urine. What is that? This is called syndrome 2. This is called syndrome 2. What is the main snake that cause this? It is viper, the Russell's vipers, which is common in South India and Sri Lanka. This is called syndrome 2. Syndrome 3, also there is local swelling with the paralysis. Local swelling with the paralysis, this is caused by cobra or king cobra, and this is syndrome 3. Syndrome 4, there is paralysis with minimal or no local swelling. History of snake bite, patient present with history of snake bite, and there is no swelling, just he presented with paralysis. What is that? This is syndrome 4. What is the cause? C, snake, which is great. And there is another syndrome, which is syndrome 5. There's paralysis with dark brown urine, and there is renal failure. What is the cause? Also, it's Russell Viper. I told you in the first part of the class that there is a family which is the largest family. Who can remember what is the largest family, please? We have 3 families. Which one is the largest one? Remember that or not? Exactly, the Vibridia. That's why if you see syndrome 2 is caused by Viper's snake, and syndrome 2 also by Viper's snakes, and syndrome 1 also by Viper's snake. Until now? Now we will move to the grading of snake bites patient. Grading is the most important part in your practice in the emergency and even if in any clinical examination. You have to know there are 5 grades for snake bites. There are 5 grades for any patient with a snake bite. But the number is like this: grade 0, grade 1, grade 2, grade 3, grade 4. So what are the patients? Who is the patient with grade 0? Grade 0 patient, I want you to know how to differentiate between all the grades. So I will focus on the tricks here. For grade 0, blah, 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 I want you to know that this is pain at the site of bite and up to 1 inch of edema and erythema. Pain at the site of the bite, the snake bite, and up to 1 inch of edema and erythema. No other manifestation, no systemic manifestation, no lab changes. There is an area of fang mark may be present, okay, and this is a snake bite, this is accepted. And patient with history of suspected snake bite, okay. No evidence of envenomation, not important. The important is that you have a patient with history of snake bite. This patient presented with just pain and up to 1 inch of edema and erythema. 1 inch is equal to 3 centimeters, about 3 centimeters. So let's say pain and less than 1 inch, less than 3 cm, edema and erythema. This is considered grade 0. What about the grade 2 or sorry, grade 1? For grade 1, here we have, I will also focus on this. Here we have pain also plus more than 1 up to 5 inches of edema and erythema. This is the trick. 1 to 5 inches or 3 to 15 centimeters of edema or erythema. This is considered grade 1. This is considered grade 1 patient with snake bite. Now to the third part, which is grade 2. In grade 2, as you see, here we have severe pain, here we have edema or ecchymosis or erythema more than 5 inches. It's spreading toward the trunk, and also the patient start to have systemic manifestations like nausea, vomiting, mild low temperature sometime. So for grade 2, the patient will have severe pain, edema spreading more than 5 inches, and the patient start to develop some systemic manifestations like nausea, vomiting. This is very common. Now what about grade 3? Grade 3, here we have also patient with pain, also patient with edema more than 5 inches, but here we have more systemic manifestations. The patients start to have tachycardia, start to have hypotension, and you have to see subnormal temperature. This is petechial and ecchymosis. You can see also this is occur within 12 hours of snake bite. So again, for grade 3, we have pain, we have spreading edema, ecchymosis, erythema. We have more advanced systemic manifestation like tachycardia and hypotension. And all these features occur within 12 hours of the bite. Now, what about the last grade, which is grade 4? Grade 4 is the same like grade 3, but it occurs within 15 minutes after the bite. So just imagine, snake bite, suddenly the patient has severe pain, progressive swelling, and systemic manifestations start to have tachycardia, swelling, hypotension within 15 minutes of the bite. What is the grade of this patient? It is grade 4. And this patient may have also convulsions and coma, very common in this patient. I will repeat the grading again, so please focus on that. They are very important. Grade 0, this patient have pain and about 1 inch of edema and erythema, no more. For grade 2, the edema is now larger. It is 1 to 5 inches of edema or erythema with also pain. To say this is a grade 2, patient have pain, but the edema separating more than the 5 inches, and in grade 2, the patient start to have other systemic manifestations like nausea and vomiting. For grade 3, the patient start to have more advanced systemic manifestations like tachycardia and hypotension, also with severe pain, and those features occur within 12 hours of the bite. What if those features occur within 15 minutes of the bite? This means systemic manifestation within 15 minutes of the bite with pain and systemic manifestation. This means this patient is grade 4. Why the grading is important? The grading is important because it's related to the treatment, and we will see that in a few minutes. Is it clear, please, for everyone until now? We make a grading for our patients. Now, what investigation you have to send this patient? You have to send this patient for CBC, complete blood count, for renal function test, for coagulation studies because you are afraid of hematological problem, and for blood grouping and cross match, and also serum electrolytes and also urine analysis. Those are the traditional, the 6 investigations that you need to send the snake bite patient at time of presentation. CBC, renal function, coagulation, blood grouping, and cross-matching, serum electrolytes, also urine analysis. Those will be why we are sending for electrolytes or urine analysis, because we need the base result of those patients or of those investigation. If the patient admitted to hospital for a few days, we need the base investigation so we can compare it day by day with other investigation by follow up the patient. Now we will speak about the treatment, the anti-snake venom serum or anti-snake venom serum, which is available as maybe just before this. I want you to know, when you have any patient with a snake bite, please, 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 always, because each hospital have special snake bites according to the protocol of that hospital, go before giving this anti-snake venom to any patient, go to the pharmacy, bring this anti-venom, read the instruction inside this type because it's different from hospital to hospital, from city to city, and from pharmaceutical company to other pharmaceutical company. But usually it is the anti-snake venom serum. It is like this, a vial with 10 cc of venom, anti-snake venom. So when to use it, how much to use, what if reaction occur, when to stop. Those are the main important question. You have to know those for the anti-snake venom if you decide to give. When to use it, if you have hemostatic abnormality, progressive local finding, neurotoxicity, systemic manifestation, generalized rhabdomyolysis. Also, all of these are indicated to give anti-snake venom serum. I have a picture here. It's more precise to be saved in your memory. So we will know about the grading. If we have grade 0, patient need no antivenom. If we have a grade 1, also no antivenom. If we have grade 2, who can remember the grade 2 patient? The grade 2 patient is the patient who is having swelling more than 5 inches and start to have systemic manifestations like nausea, vomiting. Here we can use 5 vials for that patient, but how we will give it? By the route, we can give it IV, but we have to dilute 1 to 10. That's mean if I have an ampoule or a vial containing 10 cc of antivenom, we can put this 10 cc plus 90 cc of normal saline to dilute it and give it to patients. So 1 to 10 in dilution. Clear for everyone, please? The grade 3 patient may need up to 10 vials, and the grade 4 patient may need up to 20 vials. For those patients before giving the antivenom, if the patient is stable and there's time available, do skin test before giving the antivenom, because the side effect of this antivenom is anaphylactic reaction, and we will speak about this anaphylactic reaction. So always you have a patient, imagine like this, you have a patient with a snake bite and you decide to give anti-snake venom. In this situation, your patient is stable. Why to give the antivenom directly? Before giving the antivenom, try to test this antivenom on the skin. It will show you positive reaction occur within 5 to 30 minutes. How you know that this is positive reaction? By appearance of wheal and surrounding erythema. So do the skin testing. What to do in case of anaphylactic reaction to anti-snake venom? As simple as that. As any anaphylactic reaction, you have to start by giving adrenaline, half milligram to 1 milligram IM. If there is hypotension, you will give adrenaline in dilution, normal saline. You can use also ranitidine, histamine, anti-H1 blocker, and you can use prednisolone also as another choice. But remember, for any anaphylactic shock, any anaphylactic reaction, whatever was the cause, adrenaline, adrenaline, adrenaline. The important question that you may face it from the examiner is like this. You have a patient with a snake bite, and this patient is grade 3. You give him anti-snake, antivenom, but this patient developed anaphylactic shock. Now, you deal with the anaphylactic reaction of this patient. The important question, will you stop the anti-snake venom or not? What do you think? Patient with a snake bite, grade 3, you give anti-snake antivenom, and this patient develop anaphylactic reaction. You treat this anaphylactic reaction. Now, will you continue the anti-snake or will you stop this anti-snake venom? And in any examination, because if you stop the anti-snake, this means that you are allowing the toxin to kill the body of that patient. As simple as that. If you continue, you will cause anaphylactic reaction maybe another time. So what to do? They found that you have to continue the anti-snake, but you have to dilute it more and you have to reduce the speed of giving the anti-snake for that patient. If you remember the topic of giving a blood for a patient, if you are giving a blood or doing blood transfusion to patient and this patient develop reaction to this blood, you will stop it. You will treat the reaction and then you will continue to give the blood but in a slower rate. Here also it's the same. We will reduce the dose, we will dilute the dose in isotonic saline and restart it again as soon as possible. Also, you will put another line with IV infusion of adrenaline or epinephrine to hold the allergic sequelae for that patient. So just we will continuously giving the adrenaline infusion and we will dilute the anti-snake venom more than 1 to 10. Clear, please? When to stop this? We will stop it if the bleeding stopped or subsided, if the lab value returned to baseline. Here's the baseline. We need the baseline in those patients. And also if the signs of neurotoxicity reverses or stopped and local effects halt the progression. I will go back to the 4 questions. So, anti-snake venom. When to use it if there is systemic manifestation, as simple as that. Systemic manifestation means convulsion, anything not related to the site of the bite, any feature that's not related to the site of bite, you can call it systemic manifestation in such cases to make it simple for you. So if the patient with a snake bite have vomiting or having nausea, this means that this patient having systemic manifestations. How much to use? For grade 2, we can use 5 vial. For grade 3, we can use up to 10 vial. For grade 4, we can use up to 20 vial. What if reaction occur? I will treat the reaction by giving the adrenaline, and then I will dilute the anti-snake venom more and give it again to the patient with adrenaline infusion in another IV line. When to stop anti-snake venom? If the symptoms are subsided or the lab investigation return to normal. Is it clear, please, everyone? We speak about the anti-snake venom. What about other treatment for such a patient, the supportive management? If this patient have hypotension, give a crystalloid fluid. You may need the albumin. Maybe a CV line is needed. Anticholinesterase have variable but useful rule trial. We are not using it. It's a trial until now. Atropine, you may need it. Hydrophorium chloride, neostigmine, but all of them are not mandatory to be given to the patient. I will focus on hypotension. So fluid, this is important. You must not forget it. Patient with a snake bite, if have hypotension, you have to give fluid. If this patient with a snake bite having oliguria, renal failure, remember fluid, diuretic, dopamine, monitoring of urine of that patient, and fluid restriction. Maybe this patient need also dialysis. If there is local infection, you can give antibiotic. If there is no local infection, why to give the antibiotic? If there is hematological problem, prepare the blood, fresh frozen plasma, and the cryoprecipitate. That's why in the investigation, I told you we need the blood grouping and the cross match. Syndrome. Compartment syndrome. There's any signs of compartment syndrome are present when there's compartment pressure more than 30 millimeter mercury. This is very important number. For compartment syndrome, it should be the pressure, the compartment pressure should be more than 30 to say this is compartment syndrome. What to do? In any snake bite patient swelling, always tell the patient elevate the limb. elevate the limb. And you are suspecting compartment syndrome, administer for this patient mannitol 1 to 2 gram per kg IV rapidly over 30 minutes. And simultaneously, you can administer antivenom, another antivenom, about 4 to 5 vials IV over 60 minutes. If elevated compartment pressure for another 60 minutes, consider fasciotomy in that patient. So you did those management, those protocols, and no benefit for 1 hour, you can consider fasciotomy in that patient. Now we will take a break for 10 minutes. If you have any question, please ask now before the break. Right here on the screen, so it will make, let's say you have ampoule or vial, and this vial contains 10 cc of antivenom. How you will dilute this? You will bring normal saline, for example, 90 cc to dilute this 10 cc. Clear until now, Dr. Majid? So the result will be 100 cc, but it's diluted. If you have 5 ampoule, you will give 5 ampoule to this patient. You will put them on 500 cc of fluid. So this is the dilution. This is 1 to 10. This is 1 over 10. 1 antisnake and 10 fluid. 1 to 10. Clear, please? Reaction, you may do 1 to 20, not 1 to 10. That's mean the 5 ampoule will be putting in 1000 cc of fluid, in 2 bottles of fluid. That's more dilution. You are diluted more. That's the idea of dilution. Any other question, please? I will stop the recording, then I will keep the screen and we can meet after 10 minutes. See you in 10 minutes, inshallah.